If you want to know the 4 tips to manage acute athletic injuries, you have to tune into this episode. Uh, Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know the 4 tips to manage acute athletic injuries, you have to tune into this episode. All right, before I go into the podcast, what is new in life? What's better with the family? It is amazing to watch my kids grow. My son Jacob is learning new words. His new one is bubble bath. My daughter is crushing gymnastics, and my son is all into Nintendo Switch. One day I will beat him at Mario Kart. One day, one day. My wife is behind the scenes managing all of our chaos, and she is doing amazing. If you guys haven't heard, we have some great news and announcements with Sports Performance. We're continuing to expand, and we're growing into our new location. So thank you for everybody who has supported us and continues to just support our mission and congratulate us onto the next move. And what is better with me? I am, believe it or not, I am upgrading. I continue to try and advance my fitness and everything I'm doing behind the scenes. So one of the things that I've been doing over the last probably year and a half is um, I've been doing more cold exposure. So I've been doing that in the mornings for about 10 minutes at 55 degrees, 55. I combine that with a sauna contrast bath, and that is amazing. So I have a lot of that going behind the scenes. And the big one, if you don't know, I don't love stretching. I don't love mobility work, but I do it. And I've been committed. I now invested into a program and I am doing mobility drills every day for 15 minutes early in the morning around 5 or 5:30. So that is my news to give to you guys. All right, on to the content. What are we talking about today? We're talking about acute athletic injuries, and why am I doing this content, this podcast? And it comes off of all the discussions. If you guys don't know, I just launched the Kickstarter Sports PT Kickstarter program. It's an online mentorship program we started last week, and I absolutely love it. I have been obsessive with it over the last week, and my wife is tired of hearing about it. And the biggest thing I've taken away from this is that PTs, we generally can help, I think, any athlete across the spectrum. But the challenge is we don't always have exposure to acute athletic injuries. And the challenge with that is that we typically see people, what I've learned through surveys and seeing all the people that I mentor, we typically, as an orthopedic PT, you primarily see them from week 4 to probably week 20, maybe 24, if depending on, if they're post-surgical. So the 0 to 4 weeks on an acute injury. Now we're talking non-operative, on an acute injury that happened either on a field or a high school football game or something. From 0 to 4 weeks, we typically don't see them. And I'm talking about the majority of PTs. So if you say, hey, I've been treating acute injuries for years, that's fine. I'm talking about people who don't always have that opportunity. And it's not that we don't have the skill set, is maybe we haven't tapped into the resources, and or we don't have the confidence to be able to manage those individuals. And so my goal and my mission, if you ask me what's my mission over the next couple of years, is to be a resource for sports physical therapists to continue to be able to serve a population of athletes or active members of your community from 0 to 4 weeks. That's a big deal because we typically don't see them. And the problem becomes is when you apply orthopedic principles from 4 weeks to 24 weeks, and you try to apply that same thing to an acute injury, you're actually doing them a disservice and you're going to make them worse. And I'll explain why. And so after having these discussions during the Sports PT Kickstarter, plus the conversations I'm having with my team and other physical therapists, I've realized is that we have an opportunity, but I think we have to grow our skill set and learn how to service these individuals so that they understand how we can manage them. And so, number one, I want to be able to give you a little bit more confidence and context into how you can serve these people better. So, we're going to go over 4 easy, simple, effective ways that you can manage acute athletic injuries. So, let's go on to the actual podcast. So, number one, if you don't ask the right questions, it's your fault on why an athlete doesn't get better. Now, what does that mean? So anytime that you're serving an athlete, you're like treating them, if they don't get better, especially in an acute athletic injury, it's because you didn't identify things that were going to aggravate them early on. And what I mean by that is, for instance, I created something called a sports PT checklist, and it dives deeper into the athletes. So say, for instance, they're day one ankle sprain, grade one ankle sprain, and they want to get back to sport in 5 weeks. And when you do the math before you hear the content, you do the math in your head. Do you think that this person could play in 5 weeks with a grade one ankle sprain? And now you have to go backwards, right? So say, for instance, they're at week 5, that means full throttle play. At week 4, that means they're practicing maybe with a little bit of partial contact. Week 3, they're integrating into practice with no contact. Week 2 is they can do plyometrics. Week 1 is full range of motion and strength. You're like, oof, that's a little tight timeline. And so when you talk about acute athletic injuries, when you talk about short timelines like that, there's a couple variables. What's going to make them worse? Why wouldn't they be able to do it? From a soft tissue healing perspective, can they achieve that? And those are all really big questions. However, if you don't ask those early on, imagine if they're 3 weeks in and you finally figure out that actually this would have been possible. You just lost 3 weeks. So the biggest thing you can do is ask really good questions at the front end of the evaluation, or maybe the first or second visit, or whatever it is. And my point to this is that physical therapists, if you only know what you know, and if you don't ask really good questions and all the information that you need, if it's not gathered on that initial evaluation or the first, second session, they are going to be in a very tough situation where if you try and go week to week progression, you're just going on what I called hopium. It's just a chance. Maybe they'll get better. Maybe. And you're just praying. You're just hoping that this person is going to get better. And I'm very proud of all the students in the cohorts, the physical therapists who are in this Sports PT Kickstarter, because one of the biggest takeaways they had was uh, if you're going week to week, you're doing a disservice for the athlete and for the profession. So you can't go week to week. You almost have to map exactly to a T how to get this person better. But that all starts with really good questions. So what do those questions look like? Number one, uh, how often do you exercise? The frequency, intensity, and type. So how often do you train? What's intensity? Blah, blah, blah. You have to understand what their week looks like. From there, you also understand the context of what's the timeline that we have to manage. And then number 3, you also have to know their motivation. Are they in it to win it, or is it the parent, or is it the coach? If the athlete's driven and you have a reasonable timeline and you understand the context of how much they train and be able to get back to training, now it's a little easier to understand and project. But if you don't any of those things and you just use your normal orthopedic principles, this person is not set up for success and they won't be able to play in time. Now, that's under a short timeline. So first step is you have to ask good questions about their training, what they do in the past, and what they'll be able to do while you rehab them, and then what the timeline is to be able to get them to the desired time point. Number 2, I have to identify the healing stage. Now, you're like, oh, well, duh. However, some of you haven't reviewed healing phases or like wound healing or tissue healing since maybe PT school, right? So when you talk about the first 0 to 72 up to 5 or 6 days is the inflammatory phase. In the inflammatory phase is probably the most it's a risky time point to be pushing people. whether you're a pro-inflammatory or an inflammatory or anti-inflammatory PT. So are you a stabilization PT? So if they have an ankle sprain, are you going to stabilize them and keep them locked in? Or are you a pro-inflammatory where you encourage movement, you encourage those things? So it's all about your perspective. Nothing wrong. However, you have to kind of decide, which approach you're going to take. And then you have to see at what time point can you start to push this individual. In the inflammatory phase, it's probably 0 to 3 up to 5 days. And next, you have the proliferative phase where you're coming out of the the inflammatory phase and going into remodeling. So that's going to take you anywhere from 5 days up to 4 to 6 weeks. And then you get the remodeling phase, which typically that's where, like most PTs, that's where we're solid. We're like, oh, the tissue is healing. We can totally manage that. And we know how to rehab that. That's everything we've been trained on. That's everything we've ever desired. And we dream about. Like, that's it. However, when somebody's in the inflammatory phase or the proliferative phase, you risk traumatizing that and putting them back into the inflammatory phase or going backwards. So there's a lot more risk on somebody with an acute athletic injury versus somebody in the remodeling phase. You're like, oh, the reason why you probably haven't flared people up is because you haven't really seen them in those early phases, unless it was post-operative. But when it's post-operative, your mindset is, don't mess this up. But when you're in an acute athletic injury, for some reason your brain doesn't go there. You're like, oh, they're kind of like my other athlete who was 6 weeks out. I can kind of treat them like that. No, 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 no. Treat them like a post-op. They're too risky, especially early on. And the most dangerous phase is from 2 to 4 weeks. That's that proliferative phase. So you have to understand the context of where they are in their healing phases. Just because you see them in a remodeling phase doesn't mean you can apply that to an inflammatory or proliferative. Just understand that. So if you've asked the questions and then you know their inflammatory phase, you're in a position where you can now help them. So now you have to decide where are you going to go more conservative, or where are you going to go a little bit more aggressive, especially if they have a short timeline. So you say, hey, Chris, I have somebody who is grade 1 ankle sprain and they compete in 5. Can I do this? So if they're in the first 3 to 5 days or in the inflammatory phase, you're not going to push them. You can't, like, they're not going to be able to do plyometrics. They're not going to be able to do running. They're not going to be able to do ladder drills. So the question becomes, when do you start to push them? If they're 5 weeks from competing and you have them at day 0, the question becomes, when do you start strength? And when you start plyos, and when you start pushing them into contact. So there's a very, very short timeline. I'll tell you what, you don't do it in the inflammatory phase, and you don't do it in the early proliferative phase. If you have to be able to push somebody just a little bit more, it's going to be at that peak of that proliferative, 10 to 14 days into week 4. Because if you wait too long, if you did nothing with them for the first 4 weeks and you go hard on that last week or two, they can be scarred down. They can be hypomobile. They can be hypermobile. They can have poor conditioning. They're just set up for failure. There's 2 types of PTs out there. There's the, let's see how it goes, like week to week to week to week. And they're like, let's just go to next week. Let's just see if that works. And then you're basically not setting up for success. Or you go super conservative and you're like, you know what? Let's just hold off for 5 or 6 weeks. Let's just hold to week 4. Let you get through all those phases, and then we'll have a week to really ramp you up. They're deconditioned. They have no range of motion. They have no strength, no balance. Now you put them in the game. Now you're setting up for failure because they're coming in at the worst possible time point, deconditioned, no range, no strength. They have no idea how to perform in that field. Versus you can also be super aggressive, and you in the inflammatory say, hey, you know what? No, we're going to put you on the bike. We're going to do all this stuff. You can flare this up. So there's a very fine line. So when would you have to decide when you're going to start to initiate a lot of these higher level things, especially under a short timeline. And the best time to do that is right at the peak of that proliferative. Anywhere from 10 to 14 days is when you can start to push this individual just a touch. And I'll tell you what, I've done a ton of these acute athletic injuries under different contexts, whether they're $1 million athletes community members who have a scholarship writing on this, to somebody who just is a 45-year-old and they enjoy what they do and they want to get back onto a basketball court. I've done it in a different context by thousands of athletes, and the reality is there's an art to this. And where I could tell you, if you're like, well, Chris, give me the basics, where would I push them a little more aggressively? Don't do it too soon. I would wait at least till day 14 if you have the wiggle room. Day 14 if it's a timeline of 4 to 6 weeks or less. But if they have longer, then you're going to push them to that 4-week mark. For those of you who are out there treating people only 4 weeks and on, the best thing you can get from this is the context. If somebody comes to you with an injury that's less than 4 weeks and you don't manage these individuals, you do not apply the same principles on somebody who's in a remodeling phase to somebody who's in proliferative. You don't do that. And if you ask, physical therapists can have a really good reputation, but they can also have a bad reputation because they apply the one thing to everything. Just because you can rehab an athlete at week 8 doesn't mean you can rehab an athlete at week 2 or 3. A whole different ballgame, different spectrum. You don't see it as often. And this is something that I've learned from 2 other professions. Number one, athletic trainers. Oh, I work with amazing athletic trainers who have helped me understand what that early gap is on the field injury and getting them back to the remodeling phase. That is an art, and doing it quickly. The other piece is anybody who's worked with somebody 20 weeks to 24 weeks to 1 year or 2 years, and that's the strength and conditioning world. When you blend those two, those are 2 different spectrums of the healing phases. One is super early in the inflammatory and proliferative phase, and the other is like way past the remodeling phase. And now you're working on strength conditioning, you're working on these other things. When you apply the questions from the strength and conditioning side to the healing phases of the early phase of healing, you're now in a place where you can manage people all year long. And when we talk about acute athletic injuries, you need to understand that you need to ask the best questions. Get them out there. Ask them what they do normally for training. Number 2, what's the inflammatory phase that they're in? Create the context of how you're going to manage them throughout. And then decide when you're going to be able to approach a little bit more aggressively. So you're going to go conservative from 0 to 14 days, from 14 to 28 days. So the 4-week mark is when you can start to push them a little bit more, and then ramp them up once they're past that point into the remodeling phase. Okay. Number 4, once you have this, you've asked the questions, you've identified their healing phase, you now know when you can go a little more conservative or aggressive. The next thing is put it all together. Now create the week-by-week progression going backwards. So at week 5, you're going to play. At week 4, you're going to do contact sprinting drills, multi-directional. At week 3, you're going to do initiating linear work with no contact in practice with a little bit of ball skills. At week 2, you should have initiated plyometrics both linearly and maybe laterally in a brace or whatever device that you want to do. At week 1, you should have full range of motion, be able to sustain calf raises on both legs. They should have the strength. So if they can't do those things, for a fact it's not possible. It's not possible on paper. Meaning, if you can't design it on paper, it's very difficult for people to achieve it. And the problem is, as physical therapists, we rarely work backwards. We rarely look at week 5, week 4, week 3, week 2, week 1, only if it's operative. And so when they're post-op, that's when you think going forward. Like you're like, oh, what, week 16, you can do this. So we're going to move in this direction. When it's not operative, that's where you have a barrier in your brain. You're like, you can't like switch modes. You're like, but you're non-operative. So we're going to just take it week by week. And we're all guilty of this. I've done it early in my career, and man, I still judge myself for doing it. And here's why. You have the tools, but what you need to do is just apply post-operative mindset to non-operative. And what does that mean? If they have a target, I want to run a 5K, I want to run a marathon at 3 months, and I'm battling this knee pain, you just work backwards. Month 3, month 2, month 1, what needs to happen at every single step. And if you can do that, you're in a better place to help people. Now, if you don't do any of this, you're like, whoa, like, what does this mean to me? What if I don't see acute injuries? That should bother you. I'm obsessed with like being the best, delivering the best, working with the best, bringing people to their best, both on the mentoring side and on the patient care side. And if getting average outcomes is okay for you, I don't know if that's the mindset that you've always had. Maybe that's complacency. But if you're okay with average, like what happened? It's funny, you like applied to, or you were an undergrad, you crushed it, you're like, I'm a superstar, or maybe you had a hard time in undergrad. And to get to PT school, you had to be pretty like legit. I mean, it's hard to get in PT school. Several schools are impacted. It's hard. And I know that if you're listening to this, you've been in PT school, you're crushing it. It is not an easy journey. But what made you settle for average now? Now that you're in this like great podium, you're doing a great job, and you have all these credentials, you're doing these things. What made you okay now with being average or getting average outcomes? So I think if that's the case, you need to maybe reevaluate that. But if you're obsessed with good outcomes, the best outcomes, getting people better, you're now trying to figure out what's going wrong. And if you can understand that now, if you're seeing acute injuries, what you're like, what is it that I'm doing wrong? Or why can't I get the outcomes that I want? Why can't I get these patients or athletes at the time that they want? Or, I wasn't able to get them back to sport. There's a root of the problem. And the thing is that you need to identify out of all these things I'm giving you today, which one is the one that's going to be the game changer for you. And for some of you, it's all of them. For some of you, it's like, oh, I didn't think about that. So if you've done all the steps, so number one, ask the great questions. Number two, identify the healing stage. Number three, decide when you're going to be more conservative or aggressive. Number four, create the roadmap and figure out if you need to if they don't achieve that at week 3, does that mean they can participate in sport completely? Or are they going to do 25% of the match? Are they going to do, they just want 10%? How much can they participate with your projections? So if they can't do plyos by week 3, are they going to be able to participate in practice with no contact in week 4? If that's not the case and you shift it over, are they even going to be able to play? And how important is it to them to play the whole game? Maybe they're like, I just want to be able to like be in the game for like 2 minutes. Okay, this is a different context. So understand that person's goal. And the last one I have to ask is, you have to decide, are you going to use bracing and taping early? And when do you use it? When do you wean from it? Is this something important? Absolutely. After managing thousands of acute injuries, bracing and taping needs to be part of your arsenal. If you're like, oh, I'm so anti-taping and anti-bracing, okay. But that's the remodeling phase where the tissue's already settled down and you have no risk. What about when you have high risk in short situations? You better believe you're trying to look for every single resource possible. And the people who are purists and like, I'm not a bracer, I'm not a taper. Yeah, because you don't deal with those athletes. Oh, that stuff doesn't work for the remodeling phase. Well, it doesn't ever help athletes, and they shouldn't be used or dependent on it in the remodeling phase. It's always a qualifier for the people you treat. What about the high schooler who just sprained their ankle yesterday and needs to be able to compete in 5 days? You better believe you're going to start looking at other resources. And it's only because you're not seeing that domain of people. At the course, the Sports PT Kickstarter course, I give a bell curve of the people that we normally treat. You ready for this? 10%, if you're working, depending on your environment that you work in, 10% of the people you might see are like elite athletes. They're really, really good. They're the 10% of like, they move too much. You almost like need to back them off. And then there's the 10% of the couch potato who doesn't move enough. And you're like, you just need to exercise. It doesn't matter what exercise, you just need to move more and that'll fix your pain. This person needs to move less and that'll fix their pain. And 80% of the bell curve is like, you just need to fine tune, like push them a little bit right or push them a little bit left. If you are an anti-brace or an anti-tape, it's probably because you see the couch potato just needs to move. I'd agree, that person just needs to move. But if you work on that far right side with elite athletes who have short timelines and they move too much, you need to control them. And that's why they need it. So when you ask, Chris, do you brace and tape everybody? In context, I need to know where they fall in that bell curve. Are they a high mover? They don't move enough, or they're somewhere in the middle? Tell me their timeline, give me the situation. I can tell you if I'm going to brace or tape early. And if you do, when are you bracing or taping? Easy math. Ready? The riskiest time, 0 to 14 days in the inflammatory and early in the proliferative. Then it goes back to when you be a little bit more aggressive, when they get out of the proliferative or the peak of proliferative into remodeling. So day 14 to 28. So if you ask, okay, what's the perfect scenario? How would you set this up? I would brace or tape in the 0 to 14 days. I would be a little bit more aggressive from 14 to 28 and start pushing them once they're into that remodeling phase. If you can understand healing timelines, you can understand when to push people. But the reality is, guess what? I haven't even talked about regional specific objective exams, like was it a meniscus? I'm telling you context. All those things that you guys are really good at, this is what you can manage. That's what you've been trained on. I'm here to give you context on how does that change when you manage an acute injury? Whole different ball game. And the reality is that clinicians have a hard time admitting that they don't have the confidence in the skill set, or they're like, oh yeah, I can totally treat that. No, you can't. You're a remodeling specialist and you're trying to bring that to inflammatory and proliferative. Not your ball game. You're not the, if you've heard my content in the past, I like wearing I like saying within every phase of healing, you got to figure out who the main chef is. If there who's has too many cooks in the kitchen, if you're working with an athletic trainer, if you're working with a physical therapist, you're working with a massage therapist, you're working with a chiropractor, you're working with a physician, who's the main chef managing this whole athlete's case? And if it's acute injury, acute athletic injury, and you don't have an athletic trainer or you don't have another resource, and you're the main chef, you can't apply your remodeling based chef hat to the other side. So you have to know who's wearing the hat, how many clinicians are involved, what phase of healing, and then you can service that individual. So if you're looking to maximize outcomes, use this framework because it will help you in any scenario. I promise, I've been mentoring thousands of PTs. If you can just apply this simple framework this week, try it, map it out, see who on your schedule you've been doing this wrong with and fix it. We're all guilty of it. Who cares? Take your pride away and now implement it. And I'm clearly passionate about this. This is my jam. I love managing acute injuries. I love managing trauma. I don't know why. I like pressure. I like being put in very tough situations. It's just a thing I really enjoy. And so for me, if I can get PTs to really understand how to change your framework when it comes to these type of injuries, I feel like we're doing something good in this planet because we're doing it for the profession, we're doing it for our skill set. And so that's why I created my next course, which is my sports PT accelerator course. And I created it because I had so many athletic trainers talk to me and be like, hey, I wish PTs could help with this, or they understood more about this. I also understood the strength conditioning specialist who was like, man, I don't know, like I want to be able to help them. I want to help these athletes in the acute phase. Like, what can't they do in the weight room? And if you ask a physical therapist, their best response is like, no, don't get them in the weight room. Don't do that. And I got me frustrated because we can totally move athletes at every stage. It's just you have to identify where they are, what their green lights are, what they're allowed to do, what their red lights are. I think PTs, they're generally pretty good at both ends of that. They know what like not to do and what to do. What they don't know is the yellow lights. What modifications can they do? So if they have a MCL, can they squat? At what degree? How much load? Can they do lunges? Can they do any form of variation where they can keep some muscle mass while they train? Are they allowed to do core? Can they do upper body work? What can the strength and conditioning specialist do? What can the athletic trainer on the field do, with, return to play? When can they initiate contact? Those are all yellow lights. They're not green lights, red lights. They're modifications. When can they do this at what stage? And so I created my Sports PT Accelerator course because I wanted to give PTs more tools for their toolbox to gain more of those yellow lights. What modifications can they do? How do you collaborate with higher level athletes? How do you collaborate with other medical professionals? How do you put yourself so you can manage people at every stage? Even if you're not the best, you don't have the biggest skill set, doesn't matter. You can now wear a hat, communicate effectively, and put yourself in a position where you can maximize outcomes, be a leader in your community, and represent the profession and who you are and your company in a way that you are successful. The community knows who you are, and the athlete, most importantly, the athlete has the best possible chance of competing, because that to me is like the ultimate. I love when athletes go back to sport. I love when they're like, Chris, that was amazing. Like, I get joy from that. And so if that's of interest to you, I would highly recommend joining me at my PT Accelerator course. And this year, if whenever you're listening to this, is 2023. This year, it's March 18th and 19th in San Diego at our San Diego location at Sports Performance. And we're going to cap the course because of the size and restriction. And ultimately, I want to be able to help people, and I want to keep it smaller and intimate. So I'm excited to see you guys there. If you guys are interested, we are officially launching tomorrow, whenever you listen to this. And I'm excited to be able to help you along your career path. So that is it. Those are the tips to manage acute athletic injuries, and I hope those help you in a clinical practice. If you have any questions about the content, about any of this, about my courses, send me an email. I'll personally respond, Dr. Chris at drchrisgarcia.com. And wherever you are, I hope you're staying healthy, you're moving, you're active, you're changing lives, and I will see you guys on the next episode. Take care.